scary experience. And we see that very commonly, as I'm an acute physician, so we deal with these type of cases presenting to emergency department. And according to one estimate, about 1 to 3% of the A&E attendances are due to collapses or loss of consciousness or T-locks.
Okay.
And according to one study, 50% of the population can experience an episode of loss of consciousness during their lifetime.
All right. Okay.
It has several implications, as losing consciousness, as you mentioned, could be a scary experience. It can leave you with psychological after effect, which means you are always scared of when is the next episode is going to happen. And it has several implications, not only on patient, including psychological. Sometimes it can cause physical harm, because people who faint or pass out can sometimes have physical injuries.
Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Muhammad Ilyas. He is acute consultant. Welcome, Dr. Ilyas, to Faith and Discipline podcast.
Thank you very much.
Fainting can be a very scary experience. Why do people faint?
So this is a very important topic. Fainting, commonly known as blackout, but in medical terminology, we call it as syncope.
Okay.
And the way it's described in medical literature nowadays, it's called transient loss of consciousness, or T-lock.
Okay.
So a T-lock is basically, as the name suggests, is an episode of loss of consciousness, and it happens mainly due to reduced blood flow to the brain.
Okay.
And it could be, as you said, it's could be a scary experience. And we see that very commonly, as I'm an acute physician, so we deal with these type of cases presenting to emergency department. And according to one estimate, about 1 to 3% of the A&E attendances are due to collapses or loss of consciousness or T-locks.
Okay.
And according to one study, 50% of the population can experience an episode of loss of consciousness during their lifetime.
All right. Okay.
It has several implications, as losing consciousness, as you mentioned, could be a scary experience. It can leave you with psychological after effect, which means you are always scared of when is the next episode is going to happen. And it has several implications, not only on patient, including psychological. Sometimes it can cause physical harm, because people who faint or pass out can sometimes have physical injuries as well.
Okay.
And then it can also have financial impact, because people who pass out in certain professions, there is an implication or that if you pass out, they cannot carry on with that profession.
Okay. We'll discuss that in a while. Is losing consciousness is fainting, or are there other symptoms associated with syncope?
So, broadly speaking, if we refer to episode of loss of consciousness, or as I said, T-lock, I divide it into two parts.
Okay.
Or two types of loss of consciousness. One is very simple explanation. If you had a bang on the head, you lose consciousness.
Okay.
And this is what we call as traumatic loss of consciousness.
Okay.
And we obviously deal it according to head injury protocol.
Okay.
Then people can lose consciousness without having head injury.
Okay.
What we call as a non-traumatic loss of consciousness.
Okay.
And the non-traumatic loss of consciousness we broadly divide into two categories.
Right.
They are either due to syncope or they are due to non-syncopal episodes.
Okay.
And the examples of non-syncopal variety of loss of consciousness could be like seizures.
Okay.
It could be metabolic cause like low blood sugar, or it could be toxins like alcohol, or it could be psychological.
Okay.
But when we specifically talk about the syncopal type of loss of consciousness, it is broadly classified into three varieties.
Okay.
We will go into more details as we go along with the discussion.
Okay.
But syncope by definition is that type of loss of consciousness which is rapid in onset, brief in duration, and it is followed by rapid, spontaneous, complete recovery, and it is due to reduced blood flow to the brain.
To the brain, okay. So how serious the fainting can be if the blood flow to the brain is stopped? How serious it can be?
it's not exactly stopped. It can be transiently reduced for the brain to maintain its conscious level.
Okay.
That's the, what in medical terminology we call pathophysiological process responsible for causing loss of consciousness.
Okay.
So how serious it could be? It could be very serious in a way that the syncope can be an initial presentation of something going on very seriously in the body.
Okay.
For example, it could be an indication that there is something wrong with the heart, like the rhythm of the heart, like the function of the heart, or the valves of the heart.
Okay.
Or it could be as simple as that that your body is very sensitive to certain situations. For example, some people are what we used to call as faint-hearted, which means they, when exposed to certain situation like emotional stress, pain, or something, an unexpected event, their blood pressure can drop quickly, their heart rate can slow down, which reduces blood flow of the brain, and that results in loss of consciousness.
Okay. So can we dig deep a bit and understand the types of syncope and give a bit more detail on that, please?
Yeah. Well, that's a very important question because, as I said, syncope itself, as I try to elaborate on this board as well, it could be divided into three varieties. The one very common type of syncope is what we call as neural mediated syncope,
Okay.
or simple blackouts. The second very serious type of syncope is cardiogenic syncope, or it could be related to pulmonary veins related problems or circulation related problem. And the third is orthostatic hypotension,
Okay.
which is as you change the posture and position, your blood pressure can drop. As a result, your brain doesn't receive enough blood and you can pass out.
Okay.
So neural mediated syncope, the commonest variety of it in medical terminology we call vasovagal syncope or VVS. And the vasovagal syncope is the commonest type of the syncope which you see, which could be triggered by prolonged standing, prolonged sitting, warm environment, sometimes dehydration, sometimes stress, or sometimes could be going a bit longer without any food or drink. Or sometimes pain. You might have seen people passing out while they're having injection. That's a very common type of vasovagal syncope.
Some people see blood and they pass out.
They can. It's a kind of emotional stress. We've seen that in our movies as well. When people get unexpected news, it suddenly causes change in their blood pressure and they can pass out. And then the other variety, which is very linked to it, is situational type of syncope, which can happen in certain situations. For example, some people pass out when they go to the washroom. And sometimes prolonged coughing can cause a reduction in the blood flow to the brain, and that can cause syncope.
Okay.
So this is what we call as neural mediated syncope. The underlying basic process is that whatever triggers it results in reduced blood pressure, reduced blood flow to the brain, and the people lose consciousness.
Okay.
And when they lose consciousness, the important thing to do is when they lie down or when they are laid down on the floor in a horizontal or supine position, the blood flow to the brain comes back slowly and they come around.
Okay.
So that's how it differentiated from the other types of syncope.
Okay.
And then the very serious cause of syncope, which is cardio or pulmonary type of syncope, or commonly known as cardiogenic syncope. And that could be very serious because it could be due to certain rhythm problems of the heart, either the heart rate going too fast or too slow. Or it could be due to valve dysfunction. So like valve of the heart is getting too tight or it's too leaky.
Okay.
And similarly, or the heart function itself is not working properly to pump the blood to the brain. Or it could be due to something very serious like heart attack.
Okay.
And then pulmonary means it could be due to the blood flow in the main veins around the heart. So like a blood clot in the pulmonary circulation can cause pulmonary type of syncope.
Okay.
And then the third variety, as we explained earlier or touched upon, is orthostatic hypertension. We commonly see that in elderly group of patients.
Okay.
Because and it's mainly is associated with changing posture and position, in particularly assuming the upright position.
Okay.
And when they do it suddenly, or when they may do it quickly, or if there is loss of blood volume or reduced blood pressure, then as they change their posture and position, the blood pressure drops instead of going up, and therefore they can pass out. And it could be very serious because you can imagine an elderly person trying to get off the sofa, then suddenly reduced blood flow to the brain results in loss of consciousness, can cause injuries.
Yeah.
And that injuries could sometimes be very serious.
Right. Life-threatening.
Yeah. So the non-syncopal part or non-syncopal variety of the loss of consciousness, the most common variety in our common life we see is the seizures. Typically seizures, they present with a very typical type of description. For example, they may have a warning that something is going to happen. Then they're usually not associated with any particular posture.
Okay.
They can happen while you're lying down in the bed. And then seizure patients usually presents with the symptoms like their body parts are held in a particular kind of either very stiff, and then they start jerking, and their eyes roll back, and then the face become blue rather than pale, which pale usually we see in syncope. Seizure usually patients, because their breathing is slowed down due to stiffness of the muscles, they become usually blue. They may have frothing around the mouth, and they take a bit of time to come around. So their recovery period is a bit prolonged, and they're very confused when they come around, and they will like to sleep, or they will feel very, very tired in recovery phase. And that's typical description, suggestive of seizure. But of course, complicating factor could be sometimes patients who have syncope can also have jerking of the muscles. Because the syncope, as I explained, is due to reduced blood flow to the brain, and sometimes reduced blood flow also means reduced oxygen. And that reduced oxygen can sometimes cause twitching of the muscles. And therefore, bystander who is witnessing this episode may describe it as a seizure. That the key thing in differentiating between the syncope and seizure is having that detailed history, including the description of the event as described by the witness, because that could be very key in deciding the diagnosis. So metabolic is that variety of syncope. Metabolic events like low blood sugar can also reduce brain function and result in loss of consciousness. But the difference between the syncope and the metabolic is, unless you correct the underlying abnormality, patient usually won't recover. But in syncope, simply by lying down the patient on the floor, restore the blood flow to the brain, and therefore, as a result of it, they come around. Psychogenic, obviously, you can elaborate that in the history, because it is only triggered by unpleasant experience, or when patient is upset, or when they are stressed. So when exposed to certain situation, it will trigger that event. And the toxins, again, could be very obvious if you take a good, careful history. It could be either a recreational drug, or a simple thing like they have taken too much alcohol.
When you were mentioning, like, if someone is coughing too much, patients like who have asthma or COPD, sometimes they have bouts of cough. So have you ever seen like those people having syncope experience?
Yeah, it could be, yes, because what happens during coughing, basically when you cough, you increase the pressure within the chest. And as a result of high pressure in the chest, the blood flow or the return of the blood from different parts of the body towards the heart can slow down. And that causes sometimes syncope. It usually is a prolonged coughing fits, which can result in loss of consciousness. But in some patients who are very sensitive to or very prone to passing out, sometime even a short episode of coughing can trigger it.
Okay. It will be, I believe, very challenging for you to diagnose those patients. So let's talk about the diagnosis. If a patient is presented to you with syncope, they passed out, how would you start your diagnosis?
So it's very right, as you said, that it's important to get the diagnosis right first, because you can see there are different varieties of it.
Yeah.
And it is important that you take a good history, do a good physical examination, and do some basic investigations, which can help you to put the patient in the right direction.
Yeah.
And according to one study, the patients with simple syncope had to go through 20 various tests and see 3 different specialists before they reach a diagnosis. And as we mentioned earlier on, the syncope can have lots of effects, not only on the life of the patient, their financial impact, and it can be, if you miss a specific diagnosis, for example, cardiogenic syncope can result in sudden cardiac death.
Yeah.
And if you miss that diagnosis, it can be obviously a life-changing event, not only for patient, but also for healthcare professionals.
Yeah.
And has medical legal then implications. So the diagnostic process starts with a good history taking.
Okay.
90%, up to 90% of diagnosis you can identify in a very good history. And that includes, we basically divide the history of the syncope into 3 phases. What was going on before, what happened during, and what happened afterwards.
Okay.
So we need to look into all of these 3 phases to decide what could be the likely cause.
Okay.
For example, simple explanation, a patient who let's an 80-year-old lady, she walked to the bus stop because she wants to go to the town for shopping. And on that day, she was rushing along, she missed her breakfast. And it's a warm summer day, so she was waiting there for about half an hour before the bus arrived. And as the bus was approaching, she felt dizzy, she was lightheaded, and then felt like sweaty and then passed out. So you can see in the history, there is a very clear relationship to the posture. So vasovagal syncope has a very clear 4 P's in their history.
Okay.
The first P is the posture. It only happens when they are sitting up or standing up for a long period of time.
Okay.
Never happens while you are lying in the bed. So that if you elaborate that in the history, it can help you in diagnosis. And it's the second P is there is a clear prodrome. So usually people who have a simple faint, they will feel like they are lightheaded, they're floating, they may feel like the dark is coming over, they feel nauseous, they feel sweaty, and then they can pass out. And the third P is usually there is a provoking factor. So for example, in this case scenario which I discussed is, it could be the warm, hot environment, and then missing breakfast, which could be hunger,
malnutrition,
and then mild dehydration.
Yeah.
This could be the provoking factor. And then the fourth P is a post-drome, which is invention by me because I want to elaborate in the post-event history, is that they recover quickly and they rapidly and completely.
Okay. Right.
So the first step in the diagnosis of syncope is take a good history, not only from the patient, but also from the bystanders.
Right. Witnesses.
Witness account. So the second step in the diagnosis, I divide the whole kind of diagnostic process into A, B, C, D. It's very simple to remember this way. A is the account of event, and B is the basic investigation. So then the main 3 basic investigation which every patient who presents with loss of consciousness must have. This an ECG, is a checking their blood sugar and their lying and standing blood pressure.
Okay.
And then the C is mainly the systematic examination, and then you also take a further description of the event, including what we call as a risk stratification process, which means you decide how likely it is that this patient is going to have further syncope.
Okay.
And then the D is mainly the driving and lifestyle implications.
Right. Okay.
Which we will discuss, I think, a bit later on.
Right.
So the process starts with a good history taking, physical examination, and then basic investigations, and then doing some further risk stratification to decide how likely that they're going to have further event.
Right. So this is something kind of straightforward. I would say straightforward because like the person had a history, because they could say a few things when they come back to the consciousness. There are some bystanders or witnesses. They can describe what happened. But in case the patient is unconscious and you don't get the opportunity to get the history and you don't know what happened, so I believe it will be a very challenging situation for you. Yeah. What do you do in that situation?
So this is where what we call as a obviously unwitnessed episode of loss of consciousness. And again, we go through the same kind of structure.
Okay.
So obviously you try to take his history from the patient as much as you can. Important thing is also have a look at the paramedics record, because the paramedics record will show you clearly what time they were contacted, what time they arrived on the scene, what did they observe, and how did the patient recover their conscious level, and what were their observations. So that can give you a very good diagnostic clue.
Okay.
That's the first step in patients where we don't have elaboration of the history. Okay. And the second is the assessment of the risk factors for various kind of syncope. So for example, the cardiogenic syncope is more likely to happen in a patient who are either elderly, like more than 65, who are known to have a cardiac disease, or they are on medications which can trigger arrhythmias, or they have a family history of cardiac disease in a younger group of patients. And similarly, when you do the examination, you find some abnormality on physical examination related to cardiovascular system, like a murmur. So that gives you a clue that it could likely be a cardiogenic syncope. The other good clue in the history or in this type of situation is patients who have cardiogenic syncope usually pass out suddenly without warning. And they will not be able to protect themselves because they usually have lost the consciousness before they hit the ground, and they usually sustain injuries.
Yeah.
And patients who have vasovagal syncope usually get warning.
Okay.
So they feel like lightheaded, they feel nauseous, and they're trying to do something about it before they actually pass out.
Try to grab something before they...
Yeah. So they actually can protect themselves. And then orthostatic, again, is usually more likely in elderly group of patients who are on medication, which can affect their blood pressure when they change their posture. For example, antihypertensive blood medications, vasodilators, or medications like diuretics, or if they've been having sickness, vomiting, diarrhea, or they had a blood loss, then it's more likely suggestive of that they had an orthostatic hypotension.
Okay. Thank you very much.